Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas with your tutor Dr. Shehla Aman. In today's class of embryology of the nervous system, we are going to discuss with the congenital anomalies associated with the central nervous system and discuss the development of the peripheral nervous system. So first we will discuss the holoprosencephaly. The holoprosencephaly occurs when the brain fails to divide properly into right and left hemispheres. So both the hemispheres to some extent they are joined to each other, and there are the different varieties of this holoprosencephaly, in which extent to which they fail to divide varies. So in some cases there may be two separate lateral ventricles are present, but in severe form the lateral ventricle may be fused together forming a single large ventricle, the condition called the A-lobar holoprosencephaly. So in holoprosencephaly, brain is partially divided and eyes are usually set closer together. The condition is called hypotelorism. In severe form, lateral ventricles merge into single telencephalic vesicle, that is the severer form, A-lobar holoprosencephaly. Mutation in the sonic hedgehog gene, which is responsible for development of the midline structures, are one of the cause. So this was the first anomaly because of the failure of the division of the two cerebral hemisphere, and the reason is the mutation in sonic hedgehog proteins. Next is Smith-Lamley's-Optis syndrome. This is in which the babies have the distinctive facial appearance. They have microcephaly. They have the here you can also see the microcephaly. These babies have intellectual disabilities and learning problems. They may have behavioral problems. The characteristic features of the autism are developmental condition that affects communication and the social interactions. Malformation of heart, lung, kidney, GIT, genitalia can occur. Infants with Smith-Lamley's-Optis syndromes have weak muscle tone, that is hypotonia. They can experience the feeding difficulties. They tend to grow more slowly than the other infants, so their milestones are delayed. Also, you can see there may be fusion of the fingers, usually second and third toes, that is called the syndactyly, or there may be extra finger present called polydactyly. So these are the different features of the Smith-Lamley's-Optis syndrome. Another is schizencephaly or schizencephaly, which is a rare disorder. There is a large cleft in the cerebral hemisphere. The reason is mutation in gene EMX2, and there may be developmental delay and seizures, which are the clinical presentation of the babies. Now we move on to the spina bifida. The spina bifida basically a condition in which the neural arches do not fuse with each other. So there are the different varieties of the spina bifida. First of all, the simplest one is the spina bifida occulta. In spina bifida occulta, there is usually a malfusion of the unfused vertebral arches. Also, it is covered by defect is covered by the skin, and there is a tough hair usually present. In second variety, the spina bifida with the meningocele. In this condition, you can see the meninges and the subarachnoid space protrude through the defect. In third variety, there is protrusion of the spinal cord or the nerve roots into the defect. The condition is called spina bifida with meningomyelocele. And fourth condition is spina bifida with myeloschisis, in which the neural folds do not close at all and the spinal cord is exposed to the exterior. So this is the severe form, the spina bifida with myeloschisis or myeloschisis. Another condition in which you can see neural tube defect, in which the neural arches, the cranial neuropore do not close it, and also the defect goes caudal to the neural arches as well. So because cranial neuropore do not close, the brain do not completely develop and it is exposed to the corrosive action of the amniotic fluid. So there may be acrania, that is absence of the cranial tissue, the bones bones. Then the myelencephaly, the brain is affected, and also the sacral dimple may be present. So this is the condition, the spina bifida occulta. This is one of the simplest form, the milder form of the spina bifida occulta, usually occur at the region of vertebra L5 to S1, which is again your MCQ as well. And there is a simple dimple with tuft of the hair. No other anomaly may be present. Then in spina bifida cystica, there are the two conditions. This is the spina bifida with meningocele, and this is the condition spina bifida with myeloschisis. So in spina bifida meningocele, the vertebral arches do not close, and the meninges along with the part of the spinal cord and the nerve tissue also protrude through the defect. And in the spina bifida with myeloschisis, the vertebral arches and the neural tube do not close, and it is exposed to the exterior. So this is the detailed diagram of the spina bifida with the meningomyelocele, and this is the diagram the spina bifida with the myeloschisis. So again in this diagram you can see these are the neural folds which are developing, and these neural folds when fuses in the midline, they closes the neural tube, and neural tube will be formed. For sometimes the cranial as well as the caudal neuropores are present, through which the neural tube communicate with the amniotic cavity. So this is the cranial neuropore, and this is the caudal neuropore. If there is a defective closure of the cranial neuropore, so you can see the cranial neuropore remains open, there may be myelencephaly or anencephaly, and in this condition you can see caudal to the lesion, there may be clubfoot may also be present, also there may be the rachis, and in this condition you can see the hydrocephalus may also develop. And also in this condition you can see this is spina bifida occulta, in which you can see tuft of hairs are present over the area covered by the skin. There is only the defect is only non-fusion of the vertebral arches. So this is the schematic diagram which is showing to illustrate the encephalocele in the head area of the newborn baby. This area shows the area of the posterior fontanelle, and this area shows the area of the foramen magnum where non-fusion of the bones is present, and this is the protrusion of the meninges through the defect. So in this diagram you can see only the meninges protrude out through the defect along with the subarachnoid space. In this diagram you can see along with the meninges there is protrusion of the part of the cerebellum. The defect is in cranium of the foramen magnum, and here in this you can see the defect at the posterior fontanelle of the cranium, where you can see the occipital cortex protruded out along with the part of the lateral ventricle. So this condition is simply called the meningocele. In this condition in which along with meninges the brain tissue is present, this is called meningoencephalocele, and this condition in which along with brain tissue and meninges part of the ventricle also protrude out, this is called the hydromeningoencephalocele. So this is meningoencephalocele through the occipital region, the posterior fontanelle, in which occipital cortex protrude out along with the meninges. This is the diagram of the amniotic twin. One twin is normal and second twin show myelencephaly, in which there is the underdevelopment of the brain tissue. The cranial neuropore do not close, and this is exposed to the exterior. So this is the radiographic picture of the second baby, in which you can see absence of the absence or partial development of the brain tissue. Another condition which is called the hydrocephalus with the bilateral cleft pallid. So hydrocephalus is a condition in which excessive fluids accumulate in the ventricular system of the brain. So it may be obstructive hydrocephalus or it may be non-obstructive communicating hydrocephalus. So in case of the obstructive hydrocephalus, there may be obstruction in the interventricular foramen, there may be obstruction in the aqueduct of Sylvius, or there may be obstruction in the foramen of Monro or foramen of Magendie or foramen of Leschka. So any foramen can be obstructed or aqueduct can be obstructed, which leads to dilation of the ventricles proximal to the obstruction. In cases of the non-obstructive or communicating type of the hydrocephalus, there are defects in the arachnoid granulation. Either they are malformed or they produce a large amount of the CSF. So in this diagram, even you can see this is the stunt which is present in the cranial tissue to produce a pathway through which extra fluid can pass through the ventricular system, and because of this excessive fluid present in the ventricle system, the brain tissue is compressed between the cranial bones and the ventricular system, and there is underdevelopment of the cortex. So next we move on to the autonomic nervous system. Autonomic nervous system consists of sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system. In sympathetic nervous system, preganglionic neurons develop from the mental layer of the thoracolumbar region of the spinal cord. So please remember, this is your MCQ again. The mental layer of the thoracolumbar region of the spinal cord give rise to preganglionic neurons located in the lateral horn of the cord, and after short course in spinal nerve, they leave them and grows towards the postganglionic neurons. So postganglionic neurons are again after two types. They may be present in sympathetic trunk or in the visceral ganglia. So here you can see in the lateral horn of the spinal cord, the preganglionic neurons are present and they give rise to fibers which for a short distance passing through the spinal nerve, then white communicating ramus, they enters into the sympathetic ganglion where the postganglionic fibers arises and they then travel to the different parts of the body. Parasympathetic nervous system, it may be cranial or it may be sacral. It is also called the craniosacral system. So cranial parasympathetic outflow is derived from the general visceral efferent column of the brain stem. The nuclei which are present in the central nervous system are the Edinger-Westphal nucleus, which is related with the third cranial nerve, the salivatory nucleus, lacrimatory nucleus and dorsal nucleus of the vagus. So please remember these all nuclei are MCQs as well, because from all of these nuclei the cranial parasympathetic outflow is derived. As far as sacral parasympathetic outflow is related, the preganglionic cells are formed in mental layer of spinal cord near the sulcus limitans in the region of S2 to S4. This is again your MCQ as well. And postganglionic neurons lie near the viscera. So students, here is a surprise test for you. So which of the following is most closely associated with regulation of the visceral and the endocrine function? So remember, these are visceral function and endocrine functions collectively. It may be telencephalon, it may be mesencephalon, it may be myelencephalon, it may be metencephalon, or it may be the diencephalon. So answers are given at the end of the lecture. Another MCQ is which of the following is most closely associated with the third ventricle? So third ventricle is present either in telencephalon, mesencephalon, it may be in the myelencephalon or in the metencephalon or in the diencephalon. So please write down your answer and we'll check at the end. Then in development of the CNS, there are the 5 primary brain vesicles. During 5th week, each brain vesicles divide into 2 parts. Pontine flexure is in direction opposite the mesencephalic and the cervical flexure. The neural epithelial cells are found in the marginal layer. So write down your answer please. So next is in development of the CNS, the sulcus limitans is found in diencephalon. The infundibulum is an outgrowth of telencephalon that develops into the neurohypophysis. The sensory nuclei in hindbrain lie ventral to the sulcus limitans, and the inner ear is derived from the surface ectoderm. Next is in development of the CNS, the neural groove gives rise to neural crest cells. Neural folds are composed of the neuroepithelial cells. Neural tube maintains temporary contact with the yolk sac. Failure of the cranial neuropore to close leads to the spina bifida. Which of the following congenital malformation can be diagnosed in the first trimester? So remember, this is first trimester. That is microencephaly, anencephaly, meningocele and encephalocele. Write down your answers, please. So a male neonate is noticed to have a large sac-like protrusion of the brain and its meninges in back of the head. So what is the diagnosis? So remember, this is a large sac-like protrusion of the brain and the meninges in the area of back of head. So answer can be meningoencephalocele, anencephaly, meningocele, meningomyelocele are the hydrocephalus. The male neonate is noted at birth to have a gross deformity of his lower back. Clinical examination revealed disorganized and trapped neural tissue. What is the diagnosis? So remember, there is a deformity of lower back and there is disorganized and trapped neural tissue. So deformity can be hydrocephalus, it can be meningocele, it can be meningomyelocele, it can be syringomyelia or the meningitis. Question number 9 is the female baby neonate is noted to have a pronounced enlargement of her head. She develops seizures. MRI, that is magnetic resonance imaging, reveals excessive accumulation of the CSF fluid and dilation of the ventricles with partial atrophy of the cerebral cortex. So what is the diagnosis of this condition? It can be anencephaly, it can be hydrocephalus, hydrancephaly, porencephaly or microcephaly. So please write down your answer. And this is the key to your surprise test. So please match the key with your answers and give me a feedback. Thank you very much. These are the references: the Langman's Medical Embryology, The Developing Human by Keith Elmore, and Gray's Anatomy by the Susan Strand in the 40th edition. So thank you, dear students, for your attention and for your surprise test. In today's class, here I complete the development of the central nervous system, and inshallah we will meet in the next class. Allah Hafiz.